Hello, everyone, and welcome to a new session with Rights and Responsibilities Awareness Initiative. Lucky again to have Ernest Johansson, mental health expert, to talk to us about PTSD. Ernest, thank you so much for being here with us today.
Thank you, Hetham. I'm always very glad to be here and talk about mental health. I very much believe that everyone has a right and a capacity to get help with any mental health issue they might be facing, and we're all better off for it in working to destigmatize various issues or diagnoses or conditions is a large part of that work. So I very much believe in this. So thank you for the opportunity. It is very appreciated.
You are always welcome, and we're lucky to have you on board, my friend. So,
Thank you.
PTSD.
Yes, PTSD, and this is a this is a disorder that appears a lot, actually, in pop culture, television, movies, books, and which can be a good thing, insofar as people are aware that it's something, but also a lot of misinformation gets out there. So I really hope to dispel some of that in talking about it. And so post-traumatic stress disorder, PTSD, and there's also complex post-traumatic stress disorder or CPTSD. Um, they differ a little bit in causal agents, and the treatment overlaps significantly. So I'll talk about both and highlight those similarities and differences. So post-traumatic stress disorder or PTSD is a mental health condition that is caused by an extremely stressful or terrifying, often near death or highly acutely scary and dangerous event, and it can be from witnessing it or being a part of it. Symptoms include flashbacks, nightmares, severe anxiety, and then uncontrollable, racing, out of control thoughts about the event. Um, and people who experience a traumatic event that would be of the caliber to cause PTSD will have a lot of time adjusting and coping for a period of time. And generally, over a period of time, symptoms get better. But if they don't, if they last for months and years and impact daily function, the individual may have PTSD. Um, and treatment, once you get symptoms, is incredibly important. And the treatment, there's a well-established record of PTSD treatments working as well. So the symptoms, post-traumatic stress disorder can start roughly 3 months after a traumatic event. And that said, not all the symptoms appear immediately. Symptoms can maybe even appear years after the event. They can be triggered by an anniversary. They can be triggered by some sort of similar stimulus that reminds you of the event. Um, Hypothetically, if you were in a very bad car crash, then driving the same stretch of road or being a passenger on the same stretch of road may cause further symptoms. If the symptoms last more than 1 month and they cause problems in day-to-day functions, social functions, work functions, your ability to engage with others, or your ability to engage in daily tasks, those are PTSD symptoms. There's four types of symptoms: intrusive memories, avoidance, negative changes in thinking and mood, and changing in physical and emotional reactions. And they can vary over time, and the impacts and expressions of these symptoms vary person to person. Intrusive symptoms, intrusive memories, are unwanted, distressing memories of the event that come back over and over again, reliving the traumatic event as if it were happening again, um, commonly known as like a flashback episode. Dreams or nightmares, upsetting dreams or nightmares regarding the event, and severe emotional distress or psychological reaction to something that might remind you of the traumatic event. It can be, again, using the car crash analogy, it can be seeing a car that looked similar to another car involved in the crash, and having a very distressful emotional reaction to that experience. Avoidance can include not trying to talk about the event or staying away from places, activities, or people that remind you of the traumatic event. Um, the next piece is negative changes in thinking and mood, and this one is a little bit more robust. Negative thoughts about yourself or other people or the world, negative emotions of fear, blame, guilt, anger, and shame, even if it was very clear that, you know, the individual didn't cause the situation, they can still feel guilt and shame. Problems with memory, like not remembering certain aspects of the event, feeling detached from friends and family, especially around those who might have limited awareness of the event, not being interested in activities that were previously enjoyable or typically enjoyable, having a hard time feeling positive emotions, and feeling emotionally numb. The next one is changes in physical and emotional reactions. And that can be being easily startled or frightened beyond one's normal baseline, always being on guard for danger, kind of a hyper level of arousal and alertness, self-destructive behavior such as addictive patterns or reckless behavior like driving too fast, trouble sleeping, trouble concentrating, irritability, angry outbursts, aggressive behavior, especially around certain stimulus, physical reactions such as sweating, rapid breathing, or fast heart rate, or shaking. And then when kids are younger than the age of 6, they don't have a lot of the same brain capacity. So there can be elements of reenacting the traumatic event, often through play, and then frightening dreams that may or may not necessarily be overtly detectable as part of the event. The symptoms, they vary in terms of how hard they are. You can have PTSD symptoms when you're at a more general level of stress and when you come across things that remind you of the accident or incident. Um, and also things like anniversaries, as I said earlier, the same time of the year can remind you of the event, and you can have a stress reaction and more intense symptoms. You can hear a car backfire, and if you're someone who's been in a war zone, which causes either a form of PTSD or complex PTSD, um, it can cause you to relive the experience. And that's something that's actually commonly portrayed in media. Or you could see something in the news that speaks of a similar event that can cause symptoms, such as someone who was robbed at gunpoint. If they hear about an armed robbery at some point in the news, that may cause symptoms for them. Now, in terms of seeing a doctor, um, basically when these disturbing thoughts and feelings go on for more than a month, if they're severe, and especially if they're impacting your day-to-day life, including capacity to take care of yourself, doing, sleeping well or eating well or engaging in day-to-day activities, that's when you should seek a healthcare professional, be it a doctor or a mental health professional. Um, and the sooner you get treatment, the sooner you get better, and that can also cut off a lot of worsening of symptoms over time. Additionally, and this is very important, um, people with PTSD and complex PTSD tend to have a higher frequency of suicidal ideation and suicidal actions. So if individual is having suicidal thoughts, reaching out to a close friend or loved one, contacting someone trusted in their community, whether it's a union rep or a doctor or a teacher, or if they're spiritual or religious, someone in their religious community or what have you. And frankly, calling a suicide hotline and such as Reach Out or 988. And 988 is really easy to engage with because it's just three numbers, 988, and it is in the entirety of the US, in the entirety of Canada. You can also text that number. Um, and then also make an appointment with a mental health or professional or a doctor. And if you know of a suicide attempt or you feel one's oncoming, call 911 or go to the emergency department right away. So, yeah. Now, I'm going to go over the causes of PTSD, then I'll highlight, it fits well in the discussion right here, highlight some of the differences between PTSD and complex PTSD. So the causes of PTSD are when you go through or learn about a very significantly traumatic event, either witnessing it or being part of it. And that can involve potential death or threatened death, serious injury, sexual assault, significant loss, acute significant loss, a disappearance, or what have you. And some people get PTSD and some people don't. There's no real rhyme or reason. Um, but the commonalities are extremely stressful experiences, um, on top of whatever trauma or severe experiences or severe life circumstances or severe trauma one has gone through previously. Inherited mental health risks, such as a family history of anxiety and depression. People with a family history of anxiety and depression are more prone to PTSD and complex PTSD. Um, Personality features, temperament, people who are often more empathetic, if they witness an event, will be more impacted by it, um, for instance. And also, there are changes in how your brain regulates itself. You spend more time processing fear in the fear centers of your brain, in your amygdala instead of your prefrontal cortex. Um, and that essentially your touch points in your brain change if you have more of a propensity for PTSD. Risk factors, long-lasting traumatic experiences, a long-lasting physical injury during the traumatic experience, um, earlier exposure to trauma, especially childhood trauma, or a job that exposes an individual to traumatic events frequently, such as a firefighter or EMS driver or someone who's potentially in the military, or frankly, civilians who live in a war zone and have been exposed to military conflict. Again, other mental health diagnoses such as anxiety or depression, um, misusing substances or drugs, isolation and not having a good support network, and also blood relatives with themselves with PTSD. Now, the most common events that cause PTSD, as mentioned, some of these mentioned earlier, combat exposure, childhood physical abuse, childhood sexual abuse, general sexual violence, general physical assault, threatened with a weapon or a mechanism that can end one's life potentially immediately, and life-threatening accidents. Um, there are many, the accidents can be fire, natural disasters, the physical could be a plane crash, the physical events could be robbery, kidnapping, uh, or even a life-threatening, an acutely immediate life-threatening diagnosis, being exposed to military conflict or a wider violent event. Now, complex PTSD, I have to switch my notes here because I had that in different notes. It differs on a couple of levels. So it's essentially the same, and the flashback symptoms, the avoidance and detachment symptoms, hypervigilance or extreme alertness towards danger, frequent negative thoughts and emotions, those are common. And very much there's an increased degree of reactivity and an increased degree of aggression. There is a much more higher propensity for negative feelings of self-worth, shame, guilt, failure to prevent the event, failure to remove loved ones from the event, and worthlessness. And there becomes a significant challenge in maintaining and forming and then maintaining significant, meaningful friendships, romantic relationships, family relationships, what have you. And typically, complex PTSD, the major variant is length of exposure and timing of exposure. So whereas a singular violent event might cause PTSD, repeated exposure to domestic violence or physical abuse over a long period of time can cause complex PTSD. Being in a war zone, being in a situation where individuals are tortured, or there is a genocide carried out, or there is a situation where, which still happens in the modern world, slavery happens. Those are things that can cause complex PTSD. And those are longitudinal exposures to significant trauma that include long periods of hypervigilance, long periods of helplessness, long periods of instability and chaos. And there is an increased degree of changes to your brain chemistry. Your amygdala, which is the part of your brain that processes fear and emotions, becomes hypervigilant. Your hippocampus, the part of your brain that is responsible for learning and memory, it becomes harder to access and is less engaged. In your prefrontal cortex, which involves planning and executive function, expressions of personality, a lot of social behaviors, um, that is de-emphasized. In your amygdala, again, kind of takes over a lot of your brain's energy disproportionately. So those are the differences. Um, but there is a tremendous amount of crossover between the two. So going back to the main discussion of PTSD, PTSD can also be comorbid or concurrent with depression and anxiety disorders, increased instances of alcohol and drug use, and increased instances of suicidality, either having suicidal ideation, passive thoughts, or more active thoughts or even actions around suicide. And again, reach out for help if you're experiencing that. 988, reach out, attend an emergency room, call 911. Um, Another significant difference between PTSD and CPTSD is that there's a lot of, especially with individuals with childhood trauma, there's a lot of occurrence of personality disorders, which such as borderline personality disorder, which I believe we have another talk on or have had another talk on. And that just know that that runs concurrent. It goes along with feelings of low self-worth and trying to negotiate very complex traumas with a skill set that is heavily negatively impacted by the trauma and the timing of the trauma. Now, prevention for both. So if an individual survives a traumatic event, it's very natural for PTSD-like symptoms to initially arise. And generally that happens over the first month or so after the event. But most people will have those symptoms diminish and not impact their daily life after a period of um, post-event bereavement or what have you. Now, if these now, I would not say that one shouldn't reach out for help if they're having symptoms, but it's only been a month. Absolutely. Victim services exist for a reason. Crisis mental health services exist for a reason. Access those services if you're experiencing post-event symptoms of the trauma. You're still in the trauma of that event in the first month, but by all means, access services. However, if they ask longer than a month, um, reach out for help. And it could be as simple as a family friend, but often it's best to attend to a medical professional or a mental health professional. Um, it's very common for people using escapes such as gambling or alcohol or drugs to address this, and that can be problematic for reasons discussed in uh, other discussions. So regarding treatment, I'm going to go back to another set of my notes. Um, so psychotherapy is the main treatment used for PTSD and complex PTSD. Typically, it's CBT, which is cognitive behavioral therapy, or you can have what's called trauma-focused CBT, which is simply behavioral therapy around a trauma. And this has to be done by a licensed professional. It can't be just someone who's a life coach, which is, by the way, very unregulated, but not saying life coaches can't be good, but for this kind of issue, a regulated professional such as a psychologist, a psychotherapist, a social worker, an RSW, registered social worker. Um, and basically, trauma-focused CBT focuses on learning how your bodies in general, but your body individually, processes trauma and stress, learning how to manage the symptoms of that trauma and stress, and then learning how to identify problematic thinking patterns and then ultimately reframing them and changing them. For instance, it's not uncommon for someone who was a passenger in a car crash where someone was significantly injured or hurt or even killed, and they might blame themselves. Oh, why didn't I drive? Why did I ask for a ride? And reframing that thought pattern into, I couldn't have known this would have happened. I wasn't responsible for what happened. I have feelings of loss and sadness, but this is not my fault. Yeah, I mean, that's a very quick example of reframing those thoughts. Um, and then exposure therapy can be part of it, just because people with PTSD and CPTSD tend to become avoidant of things and situations associated with their trauma. And on one hand, that avoidance is a protection mechanism. It is a short-term protection mechanism. However, they can become significantly limiting events in life. It's possible but having a life where you never get in a car would be very limiting in the modern world. Although, hey, if one could pull it off without it being limiting, I would, give my respect to them. But if one's trauma is centered around being in a car, they're often, if they're avoidant of it, they're limiting their life's options. So basically, exposure therapy is providing for as much safety as can be provided, but exposing an individual to a stimulus that often reminds them of the trauma, gently and little by little in a progressive fashion, such that they're able to process their feelings and they're no longer, eventually over time, through the course of treatment, no longer triggered by that stimulus. Um, so slow exposure that causes the trauma response and the slow exposure to the entity that causes the trauma response and anxiety and the trauma reaction. EMDR is another treatment that is relatively new. I want to say it's roughly 18 years old. I'd have to look that up. But basically um, it focuses on EMDR is eye movement desensitization and reprocessing. So it's a therapy that helps people reprocess the relationship with a particular trauma and desensitizes them to the elements that are triggering about that trauma. And the science of it has become more and more robust over the years, but it immediately showed effectiveness when it was first kind of on the treatment menu of options, so to speak. And there's also cognitive processing therapy, which is it's a trauma focused therapy that allows people to process their thoughts about an event in a safe and therapeutic environment. Now, uh, sometimes medication is required. Antidepressants and anti-anxiety medications are very, very common uh, because the manner in which those medications impact your brain also has a positive impact on the harms of complex PTSD in particular, but also PTSD. And then sleep medications because sleep is often a triggering event for people with PTSD. Now, um, sometimes, especially with complex PTSD, it is a lifelong condition that people learn to manage and live with. Um, and and but they have to be aware and take care around how to manage it in a safe way. But it can be done. And living a life where you tend to a wider pattern of your mental health, facets in your life that impact mental health, um, such as exercising, setting realistic goals, um, being educating people around you such you have an empathetic environment, seeking out comfort and knowing when you're triggered, what your go-tos to comfort yourself are, um, support groups, and then being patient and kind with yourself. And then ongoing engagement with mental health professionals. And I don't mean to be a downer in saying it can be a lifelong condition, but also it's important to be like aware of that and that really important to say that people who have been exposed to significant trauma, especially in the case of CPTSD, can live good lives as long as they take care of themselves. And yeah, so I hope that's been illuminating. And there's a lot of difficult things that can cause these disorders, and it's a reality that impacts a lot of people in our communities and in the world.
Yes, indeed, Ernest. And as we are saying always, there is always a hope. There is
Yes.
always that door open somewhere, but we need to reach out to it.
Yeah, and reach out to it without shame. Like a lot of the discussions I have as a mental health professional is, well, someone has it worse, someone was exposed worse, and it's like that's always true. There's someone who had it worse and someone who had it better. Doesn't mean you're not worthy of help. And a lot of times trauma will put roadblocks in the way of people getting help. And the reality is we're all worthy of help, no matter the condition, no matter the situation.
And the
And
professional will never judge you, will never
no,
shame you, will never. They're here
not
to
at all.
help you, to take your hand, to walk you through this until you beat it.
That's right.
And when there is a will, there is always a way.
Yeah, and the key is just reaching out for help. That's it. Just open that door.
Indeed. Thank you so much, Ernest. This is really, as always, fruitful, full of knowledge. We're lucky to have you always, and thank you so much for your kind help and support.
No problem. And I always appreciate talking to you. I very much believe in educating the public on mental health conditions and to get treatment. So thank you very, very much.
You are always welcome, and for everyone, thank you so much. And we are looking forward to see you at another session with Rights and Responsibilities Awareness Initiative. Stay well and stay safe.